Great.
So I can start.
Absolutely.
Well, good morning, everybody. I'm so pleased to be able to join your community today to talk about something that has been my passion and my profession now for about 9 months. Ever since the pandemic, since the COVID pandemic hit the world stage, I have dedicated my professional self, my professional career to helping control the pandemic, the spread of the pandemic. I work full time for the Philadelphia Department of Public Health as a clinician, and my job is to support the contact tracers, case investigators, and information specialists who work in the city and county of Philadelphia to try to stem the spread of COVID. A very challenging job, but a very gratifying one to know that I can be behind the scenes and help answer questions and help people stay safe. And that's my goal today, is to cover the basics of COVID so that I can help you stay safe in the midst of this pandemic and the upcoming holidays and beyond. Now, if you give me a minute, there we go. I'm trying to learn how to manipulate my slides remotely. This is a whole new world for people like me who did not grow up with this technology, or like us, I should say. So I want to start by just asking, can we talk? I need to talk about some kind of upsetting or unsettling facts, and that is that, first of all, COVID has been responsible for millions of infections and hundreds of thousands of deaths globally since it emerged on the world stage last November or December. The grim statistics, and I looked up these data just a couple days ago when I put this slide together. First of all, the infections, the number of infections, those people who tested positive and had an infection with COVID, over 17,443,366, huge number, percent of our population. The deaths in the US as of the 19th, 322,952. And if I were to look at that number today, I would guess it's probably closer to 330,000 because the death rate is spiraling. In Delaware County, the numbers of infections, 26,061, and the number of deaths, unfortunately, 925 since the start of the pandemic. And also unfortunate in that figure is that a large majority, close to 40% of those deaths, are among people over 65 who live in community dwelling situations such as nursing homes. It's just tragic. So what is COVID? I want to do a brief review. If you haven't been inundated by the media enough, I'll talk about COVID in its basic form. It's a novel coronavirus. You heard people talk about it being a novel virus. That simply means it is a brand new virus. We never had it before. It represents perhaps a mutation from something else. It was discovered in Wuhan, China in November of 2019, when the first reported case of a COVID infection hit the media. Coronaviruses are nothing new, though, themselves. They are a large family of viruses that are known to cause many illnesses, ranging from the common cold to more severe diseases such as H1N1 flu and other severe illnesses. This COVID-19, however, is a brand new virus, which made it especially virulent because we had nothing to fight it. So I want to review the symptoms of COVID, and when I finish reviewing them, I want to make a comment about them. The symptoms of COVID include fever and chills, shortness of breath or difficulty breathing, new loss of sense of taste and or smell, muscle body or aches, nausea and vomiting, congestion or runny nose, cough, fatigue, sore throat, headache, and there's sore throat again. I thought I corrected that, and diarrhea. What's interesting about this list is this could be the symptoms of influenza, couldn't it? You almost universally have fever, fatigue, cough, muscle body aches when you have the flu. So how do I know if I have flu or I have COVID? Well, one way to find out is to be tested for both and determine which it is. But one of the distinguishing symptoms of COVID that almost never appears. In fact, I've never heard it to appear in flu, is a sudden loss of the sense of taste and smell. Now, for those of us who are cotton tops, as it were, we tend to have a decreased taste sensation anyway, but we still can taste, right? So it's not that usual decreased taste sensation that seniors such as we have. It's truly a complete loss of taste and smell. I had a patient yesterday who said, I think I have COVID because I have these symptoms, but 2 days ago, I had curry for dinner. And yesterday, I reheated the curry for lunch and I couldn't taste it. Now that's a pretty compelling story of somebody who suddenly lost their taste. And in fact, he tested positive for COVID. It's important that I point out the warning signs of COVID. Again, if you get sick, we say stay home, take care of yourself. But if you have warning signs of COVID, or if you have severe underlying medical conditions, you definitely want to seek emergency medical attention. And the first warning sign that I want to talk about is trouble breathing. Now, trouble breathing means shortness of breath, can't catch a breath. And it's unlike the trouble breathing that some of us have who might have COPD or other lung problems. It's definitely something new or a worsening of a previous pulmonary condition. You feel like you just can't get enough air. The other is persistent pain or pressure in the chest. Now, that can be anything like an elephant on your chest, or it could even be something mild, but it's persistent. That could suggest lung inflammation. It could suggest heart problems, but lung inflammation can present as persistent pain or pressure in the chest. New confusion. Now, I know, and I tease my husband about his being confused all the time, but this is something different. This is, today I'm fine and able to carry on a conversation and engage in all of my normal daily activities. And tomorrow, the patient might just be very confused, might not remember the date, might just not be able to speak well. Now, that certainly could be signs of a number of things like stroke or other problems, but any new confusion can also suggest that your brain is not getting enough oxygen. And because COVID is a disease of the lungs, if the lungs are impaired, they can't transfer the oxygen that you take in to the rest of your body, including that very vital organ, the brain. Inability to wake or stay awake, of course, that would be a red flag in any case. Often the patient's not the one that reports this symptom. It's a family member calling in to say, my husband who tested positive for COVID 4 days ago is really, I can't wake him up. He kind of wakes up, then he goes back to sleep. He wakes up and then he goes back to sleep in 5 minutes. That would be a worrisome sign as well of lack of oxygen or insufficient oxygen in the brain. Bluish lips or face is another sign of inadequate oxygen going into the bloodstream. You notice it kind of around the lips, you might notice it inside the mucous membranes, or even the nail beds might be slightly blue. Again, those are warning signs of COVID that would require you to seek or call for immediate medical support. But the main purpose of today's talk is to review how to protect yourself and others from COVID. As I'm sure anybody who has the TV on or reads a newspaper in the day will know, this pandemic is surging in the US and notably in Delaware County and Philadelphia County where I work. And it's surging because for a lot of reasons, but one of which is there's so much COVID fatigue out there. People are just tired of staying home, of staying away from activities that they love to engage in. And most importantly, they're just tired and lonely without family around. And we're seeing a surge. It started before Thanksgiving, but I can tell you the numbers of people that came. I work part-time in urgent care, so I still work clinically as well. And the number of people that have come into the urgent care in the 5 to 10 days, 14 days following Thanksgiving who have tested positive for COVID is astronomical. People didn't always heed the warnings not to go to share Thanksgiving with many people, because who wants to stay home alone with their turkey dinner? You know, I certainly don't, but we did. But many people opted to join with family and friends who they believe to be safe. They're my family. I know what they do. They're my close friends. I know they're taking care of themselves, but you can't always know. So how do you protect yourself? And I'm going to go through a list of pointers that then we'll go into in a little more detail. One is just know how COVID spreads. And when you know how it spreads, then you can know how to prevent its spread to the greatest extent possible. The other is wash your hands often. Avoid close contact with others. And that is that phrase you hear a lot of, social distancing. That is, maintain social distance, which means stay at least 6 feet away from others at all times. 4, wear a mask. Wear a mask. There's virtually no medical contraindication to mask wearing. Despite what some may say, oh, it's hard for me to breathe in a mask. It's hard, you know, for what? The only reason one would not wear a mask is if they are so incapacitated that they can't get the mask off by themselves. That's the only medical reason not to wear a mask. And speaking as one who worked 14 hours yesterday wearing an N95 and a procedure mask nonstop, I can tell you it's no fun. It must be done. Cover your coughs and sneezes. Now, this is what we tell our children and grandchildren from the day they can listen. Cover your coughs and sneezes. Clean and disinfect the surfaces that you touch, and monitor your health daily. Now, let me go into some detail on these. First of all, know how COVID spreads. Number one, it spreads very easily. It spreads easily between people who are in close contact with one another. It's spread through droplets that come from the nose and the mouth when an infected person coughs, sneezes, breathes, sings, or talks. And you've heard of cases of church choirs all becoming infected because they're singing, and people who sing know that you use your diaphragm and you breathe and you really project. That sends the COVID droplets farther in the space. Even talking can create droplets that leave your mouth. There's some possible connection with spread as an aerosol, meaning in the air, like measles does, but that's not confirmed just yet. But in fact, we do talk about staying in well-ventilated rooms. That's why we don't have people crowding, well, indoor restaurants, at least in Philadelphia, are closed again, but we don't like people in crowded rooms, even if they're 6 feet apart. Even in churches where they're singing, we don't like that because there's a suggestion that some of these droplets become aerosolized, which are microscopic little particles that float through the air. And these droplets cause infection when they are inhaled through your nose or mouth or deposited on a mucous membrane, such as the lining of your nose and mouth. Then from the mucous membranes, they invade the bloodstream. Now, it's very important to know that people can be infected but have no symptoms at all. And these people can still spread the virus to others. That's what makes this especially frightening. Young people, children in particular, might not have symptoms, or they have those typical daycare symptoms of runny nose and cough, and they could be COVID positive, and even though they really don't have symptoms or can't verbalize how badly they feel, they can spread this to other. People in their teens and 20s often are asymptomatic, meaning have no symptoms of COVID, but are infected and can spread it to others. That's why the spread is so easily done and why it's so hard, can be so hard to control. Obviously, wash your hands often. You probably know this, wash your hands with soap and water for 20 seconds or more. And that should be done after eating or before eating or preparing foods, before touching your face, after using the restrooms, after leaving a public place, after blowing your nose, coughing or sneezing, and even after handling your mask. Let's say you've been wearing a mask, you've been in a crowd or you've been near somebody and there are viral particles on your mask. So you take your mask off, you want to wash your hands. And there's a proper way to put on and take off a mask, and it does not involve touching the face part, but rather the loops that hold it on. Nonetheless, wash your hands after taking off your mask. If soap and water are not available, you can use hand sanitizer that contains at least 60% alcohol. At the beginning of the pandemic, this was trying to find oil when you were trying to find hand sanitizer, you know, that precious, precious commodity hand sanitizer. But now it's abundantly available. Everybody should be carrying a hand sanitizer with them. There's some that have little rings that you can attach to your bag or just have by your sink or anywhere. Constant hand sanitizing, either by hand washing or hand sanitizer, is essential. And also remember not to touch your eyes, nose, or mouth with unwashed hands, because all of those areas have membranes, mucous membranes that the virus can attach to. Now, what does it mean to avoid close contact? When you're outside your home, we want you to practice social distancing. So that's to stay 6 feet apart from others. So if those of you that go to the grocery store, let's say, when you're in line, you'll see on the floor lines that indicate 6 feet distance. Please honor those lines. I don't know about you, but I've been in some places where I've had to be, the grocery store, let's say, and people are not paying close attention and they're getting close and closer and closer. It's awkward to have to ask this, but I do ask, could you please back up to 6 feet? So practice social distancing outside your home, because again, infected people, even those without symptoms, can spread the virus to you. Avoid crowds indoors and outdoors. And the state has some new regulations that I'll go into toward the end of the program about what a crowd represents indoors and outdoors. And it's especially important for people at higher risk of severe disease that they stay away from others, or at least 6 feet from others. And of course, unfortunately, we senior citizens are at higher risk of severe disease. And those of us that have health problems, heart disease, diabetes, organ transplants, can get very, very ill with COVID. So you want to protect yourself as fully as possible. Even inside your home, certainly if anybody is sick, you want to avoid close contact with anybody who's sick with anything. Maintain 6 feet between the person who's sick and other household members. And later on, I'm going to talk about what it means to be in isolation and to quarantine in the event you have COVID or have been exposed to somebody with COVID. I want to talk about those Pennsylvania restrictions that went into effect December 12th and are in effect until the morning of January 4th. And this has to do with size of crowds and social distancing. First of all indoor dining is prohibited. You can do takeout and curbside pickup, but no indoor dining is allowed at this time. Indoor gathering of more than 10 people, gatherings of more than 10 people are prohibited. If you have a family of 16, guess what? The governor and his advisors are saying, please limit it to 10 people, if you even need to have people over at the house. Synagogues, churches, temples, mosques, houses of worship are excluded from this limitation of 10 people. Nonetheless, we strongly recommend leadership of houses of worship find alternative ways for members of their communities to worship in the way they do. It's not worth it to risk your health to be with other people in your synagogue or in your mosque. That's a medical scientific opinion. Even outdoor gatherings are limited to no more than 50 people. So no more outdoor weddings, although who would want an outdoor wedding this time of year? No more outdoor weddings of more than 50 people. Picnics, family reunions, even though they're outdoors, are limited to 50 people. In-person businesses such as the Kohl's or Walmart may only allow up to 50% of their maximum capacity in the building at a time. Gyms may only operate outdoors. If gym owners want to move their treadmills or their weights outdoors, they may, but any participant has to wear a mask. Concert venues, museums, theaters, bowling alleys, any indoor entertainment sites are prohibited from allowing people in. All kindergarten through 12th grade school sports are prohibited, and in-person extracurricular activities are prohibited in schools. However, the extracurricular activities may continue via remote methods such as Zoom or Facebook. Wear a mask. I'm going to say it again. Wear a mask. Masks help prevent you from getting or spreading the virus. Masks protect you and they protect me. And everybody should wear a mask in public and when somebody who's not a member of their household, when you're around in the house, even when somebody who's not a member of your household is there. But please, if you have access to N95 masks, this is what we've been saying since the beginning, don't wear a mask meant for a healthcare worker because they are in critical shortage still, and supplies should be reserved for healthcare workers and other first responders. So if you have an EMT in your family or a nurse or a doctor and they say, let me slip a couple N95s your way, please politely decline. They should be reserved for people who are on the front lines with COVID infected individuals. Even with a mask on, we want you to continue to practice social distancing. The mask does not substitute, but rather it supplements the requirement for social distancing. Cover coughs and sneezes. Again, we've been telling our children this since they were young. Always cover your mouth and nose with a tissue or handkerchief or that inside your elbow, right? Don't spit after coughing. You can spit into a tissue if you wrap it up and throw it in the secure waste bin or flush it in the toilet. And of course, wash your hands afterwards. Any used tissues, please throw away, don't reuse them. And then immediately wash your hands with soap and water for 20 minutes or 20 seconds or more. But if that's not available, use that hand sanitizer, which will always be available at your side, right? We want you to clean and disinfect. Now, early in the pandemic, people were wiping down packages that were delivered to their doorstep. They were wiping the outsides of their cans that they buy at the grocery store. And people were putting quite a lot of effort into cleaning and disinfecting surfaces. The evidence is not as strong now that the virus remains on surfaces as long as we thought, but still be careful. If you're handling cans at the grocery store, disinfect your hands after you put your groceries away. But certainly around the home where you touch tables, doorknobs, light switches, countertops, all handles, keyboards, keep them clean. And you can just keep a bottle of Lysol spray cleaner around and just wipe things down after you use them, the bathroom handles in particular. If surfaces are dirty, for example, if your kitchen counter has some food or grease on it, clean that off first with soap and water or cleaning detergent before you sanitize. And then you can spray a household disinfectant on surfaces. Now, solution, you want something that contains 70% alcohol at least, and there are on the market really a number of ones. The Lysol disinfectant spray is the one I keep around. There's Clorox commercial solutions, disinfecting wipes. And if you know how to make a 20% solution of bleach, you can do bleach in water if you like, and just wipe it down with wipe cloths. Original Pine Sol multi-surface cleaner is one that I learned also can kill the coronavirus. One important tip about wiping the surface, and I don't know if it's in my Lex, yes, it's on the slide still. It's important to know that anything you spray or wipe on a surface to disinfect it must be allowed to air dry to be effective. If you spray the surface with one of those disinfectants and wipe it down and wipe it dry with a dry cloth, you're not giving the disinfectant enough time to kill the virus. So spray the surface and let it air dry. Some of these take 30 seconds to kill the virus, some take 2 minutes. So that's why we want you to let it air dry. And then we want you to monitor your symptoms every day. As I said, be alert for the major symptoms of COVID, including fever, cough, shortness of breath, loss of sense of taste or smell, as well as for what we call the minor symptoms, which are fatigue, chills, muscle or body aches, headache, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea. Now, in the business, we say if you have one major symptom of COVID and you've been exposed to somebody in close contact with somebody who's positive for COVID, we make the assumption that that symptom represents COVID until proven otherwise. Or if you have two or more minor symptoms, we are concerned that you probably do have COVID if you have a link to somebody who has COVID. So take these symptoms kind of seriously, monitor your temperature once a day. Again, more than anything, monitor how you feel. Because in the senior population especially, we don't mount fevers the way we did when we're younger. Our immune system has changed over time. So getting a fever is not always guaranteed when you're sick. So just if you say, well, I can't taste or smell and I'm short of breath, but I don't have a fever, that should not weigh into your decision to seek medical care. And again, if you know that you can mount a temperature, try to take it if any symptoms develop, but don't take it within 30 minutes of exercising or after taking medicines. Certainly don't take it after you've taken acetaminophen or ibuprofen that lower temperatures. Don't take it after you've just had a hot cup of coffee or a hot sandwich. And any temperature of 100.4 degrees or higher is worrisome. But again, it's important for me to repeat that you can have COVID without having a fever. Now let's wrap this up by talking about isolation and quarantine. If you become infected with COVID, you must isolate from others for 10 days. Isolation is an arrangement that separates a sick person with a contagious disease from others who aren't sick. If you've had close contact with somebody who has COVID, you must quarantine. The CDC wants us to quarantine for 14 days, but they've recently suggested that you could quarantine for 10 days if you've had no symptoms throughout. And in fact, you shouldn't have any symptoms at all, even during 14 days. You can end quarantine after 10 days if you really, really must get back to work or get back out of your house. There's still a risk of spreading to others, so mask wearing is essential. I'll repeat, mask wearing is essential. And you could end quarantine after 7 days if you test negative for COVID on day 6 or day 7 of your quarantine. Now that's a lot to absorb, and I'd like to leave with the message that the CDC recommends all quarantining last for 14 days. And I'll talk about what quarantine and isolation look like. Again, quarantine is a practice that separates and restricts people who are exposed to contagious disease for a couple of reasons. One is to see if you become sick during that quarantine period. And the other is, let's say you're in quarantine and you develop the infection without symptoms. We want you to stay away from people for 14 days. So what's the difference between isolation and quarantine? Isolation is the most restrictive practice. It's for people who are positive for COVID, symptom-free or with symptoms. You have to stay at home or a separate location. We have an isolation hotel in Philadelphia for people that can't isolate from others in their own home. We will put them up at a hotel. Stay all by yourself in a room until it's safe to be around others. And that room we'll call the sick room. Keep that sick room door closed. Again, separate from others in the home, stay in a sick room, use a separate bathroom if it's available. And if you only have one bathroom and it has to be shared, it needs to be sanitized thoroughly after the sick person uses it. And then have meals and supplies left outside your room. And the person who delivers them should leave the area before you open the door to pick up your meal. Now, this is serious stuff, people. This is what's going to stop the spread of COVID to household members. And it's very draconian, it's very limiting, and I get that. But you don't want your family members and loved ones to get COVID. If you've been exposed to somebody who has COVID, you have to quarantine. What does quarantine mean? It means stay home. Don't leave the house except for essential purposes. And essential is truly that you have to go to an emergency room, or nobody can bring you groceries or deliver groceries to your home. You can go outside and walk your dog in the fresh air, of course, but really think about whether or not it's absolutely essential for you to leave the house. And we'd ask you during the quarantine period to watch for COVID symptoms. And if any symptoms develop, if it can be done safely, we'd like you to get tested for COVID, because then we would need to know whether you should continue quarantining or whether you need to start isolating. Monitor your temperature twice a day and seek testing if it's safe to do so, whether or not you have symptoms. But please wait for at least 5 days after you've been exposed to COVID before you seek testing, because it takes about that long for enough virus to be detectable in your bloodstream. So you learned yesterday that your husband or your wife tested positive for COVID. Don't come today to a testing center unless you have strong symptoms. You need to wait 4 to 5 days and quarantine or isolate and quarantine until the test date. There's so much more I could say about quarantining and isolating and length of stay away from the public, but I'm just going to recommend that anybody who has access to a computer and the internet go to their browser and type in CDC, that stands for Centers for Disease Control, CDC Isolation and Quarantine, or CDC What to Do If You're Sick. There are some fabulous sites at CDC that will tell you everything you need to know, and they're written for lay people, not just for medical individuals. And that's what I have to say. And I don't know if we have a way of interacting in this format, but if there are any questions that either John can raise on your behalf or that anybody can bring to me, please do so. I'll be happy to try to answer them.
I'm going to look in the chat. I don't see any questions there. I didn't see any questions on the Facebook Live. Mary, thank you so much. This was very informative and detailed. And the hardest thing that I've had to keep track of is what is the difference between isolation and quarantine. Fortunately, I haven't had to do any of those things, but seeing what the difference is between them was really helpful.
Thank you. Mm-hmm.
So our plan with this is to keep this on our Facebook Live page. We're also going to put the recording up on our YouTube page as well. If you wouldn't mind sending me a PDF of your slideshow, we can also make that available to people.
I'd be happy to, John.
That would be awesome. So thank you very, very much for your time today. We really appreciate it. It's been really helpful and informative. And I just want to thank you on behalf of our senior center community.
Well, thank you for giving me this opportunity to help people stay safe from COVID. And I look forward to the time that we can be back together at the Schoolhouse Center.
Yeah, we're looking forward to that as well.
Okay.
So
bye, everybody.
Thank you very much. Happy holidays.
Thank you.
Okay. Take care.
Bye.
Bye.